Okay, let's get into this. You might have seen that headline doing the rounds. Dentists fined 150 pounds K by NHS for keeping patients' teeth too healthy. Sounds completely unbelievable, right?
It really does grab your attention.
Yeah, and, well, this deep dive, we're going to try and get to the bottom of it, because it sounds like a punishment, but actually it seems to point to a massive flaw in how NHS dentistry is set up.
Exactly. It's not a fine in the usual sense. It's about the contract system.
Right, this UDA system, units of dental activity, that's what we need to unpack.
Mm-hmm. That's the core of it. And it's how this system, maybe unintentionally, ends up financially hitting dentists who are actually really good at preventing problems in the first place.
Which leaves some money being clawed back by the NHS. And then there's the whole crisis around just getting an NHS dentist appointment. We'll look at expert views, government attempts to fix it. It's quite a story.
It really is. And that UDA system, it's fascinatingly, well, problematic. It works on points. So a basic checkup, band 1, which includes that vital preventive advice.
Yeah, how many points for that?
Just one. One UDA point.
Oh.
But then, say, you need complex work, a band 3 crown maybe, that earns the dentist 12 UDAs.
12 versus 1. Big difference.
Huge. And dentists have a target number of these UDAs they need to hit each year. If they deliver less than, I think it's 96% of that target. The NHS claws back the funding for the UDAs they didn't do. Think about that number you mentioned earlier. Practices handed back something like $147 million in 2022-23 just for not hitting those targets.
Wow. Okay, so help me connect the dots here. If a dentist is brilliant at prevention, teaches you great brushing, maybe you don't need many fillings. What happens to their income under this system? Are they actually sort of penalized for keeping people healthy?
That's precisely the issue. It's a system that, financially penalizes dentists for achieving great preventive outcomes. It's not a fine for doing something wrong. It's just baked into this quantity-first model.
Right.
The British Dental Association, the BDA, they had this analogy. It's like telling a builder they only get paid when a house falls down.
Oof, that's stark.
It is. They've been calling the system unfit for purpose for ages, warning it just sets people up for future problems because the incentives are, well, wrong.
Unfit for purpose.
Yeah.
So what does that actually look like for us, for patients trying to get care? Because we hear these awful stories, people pulling their own teeth. It's hard to believe.
It paints a really grim picture, unfortunately. The access crisis is, it's dire. Figures suggest nearly 97% of people without a regular NHS dentist just can't find one accepting new patients.
97%, that's almost everyone.
It's incredibly high. And it leads to these desperate situations, reports of people using DIY filling kits, even, attempting extractions themselves, people traveling hundreds of miles, Cornwall to Scotland, I read, just to get seen.
That's unbelievable. And complaints are up too.
Yeah, complaints about dental services jumped by about 2/3 over 5 years. People are understandably, frustrated and desperate.
It really hammers home the problem. So, okay, if this UDA system is so flawed, are there better ways? Do other countries do it differently, incentivize prevention properly?
Oh, absolutely. Many experts, and the BDA is very vocal on this, are pushing for a big shift away from UDAs towards something called capitation, or population-based funding.
Capitation, what's that?
It generally means dentists get a fixed payment per patient registered with their practice, often per year. The incentive there is to keep that patient healthy to minimize costly treatments down the line.
Okay, so it flips the incentive.
Exactly. Sweden's a good example. Their public dental system uses a lot of capitation, which encourages dentists to focus on early intervention, keeping people healthy long term.
Interesting. Any other examples?
Yeah, studies from places like Brazil and Indonesia suggest similar systems lead to more preventive care, less drilling and filling, and can even be more cost-effective overall. Meta-analyses looking globally tend to show capitation often beats fee-for-service models, like UDAs, for better health outcomes.
So the evidence seems to point away from UDAs. What about the government's fixes here? There was a recovery plan, wasn't there? Did that help at all?
Well, they did introduce some reforms. Things like Golden Hellos payments to attract dentists to underserved areas, and slight increases in the payment rate per UDA.
Okay, so some tweaks.
Some tweaks, yes. But the results? Access barely improved. It felt a bit like, putting a small plaster on a gaping wound. The fundamental issue, the UDA system itself, wasn't really tackled.
So the core problem remains.
Pretty much. There are ongoing reviews, and political parties talk about renegotiating the contract, but that underlying flaw is still there. Real change needs serious investment and a total shift in philosophy from treating sickness to actually promoting wellness. It's complex.
So let's pull this together. What does it all mean for you, listening to this? Our deep dive shows this UDA contract system effectively penalizes dentists financially if they're too successful at preventing problems. Your dentist doing great preventative work might actually see their practice income fall.
It's not about deliberately punishing good dentists. It's a flaw baked into a system that rewards quantity over quality, intervention over prevention.
Right. And the experts, looking internationally too, they overwhelmingly say we need a different model like capitation that actually supports long-term health. While there are small reforms, the big issue hasn't gone away.
It really hasn't.
Which leaves us with a really important question, doesn't it? When a healthcare system's financial setup seems to clash with what's best for your actual health, what does that mean for the future? And what kind of system do we need to truly keep you healthy?